Sensory organs, such as the ear, convert energy into electrical signals that activate specific brain regions. As sound enters the ear, the auditory cortex is activated. Sound frequencies activate specific regions within the auditory cortex. The sense of touch is processed in somatosensory cortex. Movements are controlled by motor cortex. These areas are organized in body regions. With learning, these brain regions can change. This ability to reorganize is known as neuroplasticity, which is essential to learning and memory. Maladaptive neuroplasticity occurs when the brain overcorrects in response to loss of normal input or trauma. For example, phantom limb pain is the sensation of pain that feels like it's coming from a body part that is amputated. When the limb is removed, normal input to the brain is lost. Over time, the adjacent brain functions move into the inactive brain region, causing it to become overactive. It is believed that this increased activity contributes to the sensation of pain. Chronic pain can also result from a back injury, which triggers elevated activity in somatosensory cortex. This hyperexcitable region can spread to surrounding brain regions, generating the perception of chronic pain. A similar phenomenon is seen with hearing damage. For example, tinnitus is the perception of sound when there isn't an external sound. Exposure to intense sound can destroy part of the cochlea, which causes a loss of input to specific areas of the auditory cortex. The surrounding regions move into these areas and become hyperactive, which causes tinnitus. Stimulation of the vagus nerve releases chemicals in the brain that strengthen active connections. By pairing vagus nerve stimulation with stimuli, we can drive specific forms of plasticity, reversing pathological plasticity. For example, to treat tinnitus, it is necessary to reverse the hyperexcitable area, generating the perception of sound. This is accomplished by pairing vagus nerve stimulation with the presentation of tones that activate brain regions above and below the hyperactive region of auditory cortex. This therapy drives brain plasticity to shrink the hyperactive region. A similar treatment for chronic pain or phantom limb pain could be developed by pairing vagus nerve stimulation with touch that activates regions above and below the hyperactive region of somatosensory cortex. Targeted plasticity could help to restore functions lost due to stroke or brain injury. Vagus nerve stimulation, delivered during physical therapy, has the potential to drive plasticity to accelerate recovery. As the patient progresses, a new brain region gains the ability to generate the impaired movement. The development of targeted plasticity offers the promise of using the brain's natural ability to reorganize, to treat a wide variety of neurological disorders.